Hello everyone, it is Dr. Locklear here, and I'm coming to you today with the concept of managing care. This is in volume 2 of your Pearson textbook, and it starts on page 2621. So what are we looking at when we talk about managed care? We're talking about frameworks for a way to deliver care. You, as part of the healthcare team, will be involved in managed care. Managing care provides the right processes for the patient, the right needs for the patient, but it also looks at other things such as finances and budgeting and things that the facility needs in order to provide this person a holistic approach. So we will be looking at frameworks for delivering care. We will be talking about the relationships between managing care and other concepts, and you can find that on page 2625. And those concepts are advocacy, clinical decision making, communication, ethics, healthcare systems, and teaching and learning. Analyze case management. And what is case management? We're going to talk about cost effectiveness. We're going to look at delegation, because you as a registered nurse will have to delegate duties to other RNs, LPNs, and nursing assistants, or UAPs as they are now called. The Board of Nursing has a whole algorithm of how we are to properly delegate tasks, and we will review that in class. Look at leadership and management as it relates to management care. What are the leadership styles and management components that we use? So let's get started. So managed care is a healthcare delivery system. It focuses on decreasing cost because we want to decrease cost for the patient so their stay is as accurate to the needs that they had while they were in there. They're not being overcharged. But think about this. You as an employee are affected by budget, and it affects your salaries, and it affects if you get a raise each year as well. So we have to look at cost. So managed care focuses on decreasing cost and improving outcomes for groups of patients. In this system, care is carefully planned from the initial contact with the patient through the conclusion of the patient's specific health problems. So discharge planning begins the day the patient's admitted. You don't wait until the doctor writes the order to discharge to start discharge planning. And we want them to get them well and get them out of there as soon as possible, and that cuts cost as well. Although exact methods used to manage care differ depending on the delivery models used, the overarching goals of lower cost and better outcomes remain constant. So we are looking at cost, but we want the best possible outcome for the patient. And it brought out in this chapter that sometimes with managed care programs, you see more frequent admissions because patients are being discharged sooner. And is that always the best practice? Are they well enough to go home at that point? Managed care is an important topic in nursing practice. It shapes numerous aspects of the healthcare system, and it is the basis of our healthcare system. As payers search for ways to better contain rising costs, they continue to develop new incentives and standards, and these create trends in healthcare for improvement and for decreasing costs. Some of these trends have positive consequences, such as an increased focus on preventive care. Others have the potential to create negative consequences, such as I said, more hospital readmissions because they are released too early sometimes. And we'll talk about specific diseases, like if you go in for gallbladder surgery, you will have a pathway that says a person that doesn't have any complications may need to be discharged within 3 days. Well, that might not be what that particular person needs. And so a lot of times these insurance companies go by these pathways, and that's how they pay. They expect you to be out of there by a certain number of days. Within the managed care system, nurses may be involved in a variety of processes aimed at promoting high-quality care for patients while maintaining cost effectiveness. Delegation, and here's where you come in, knowing how to properly delegate. We distribute routine tasks to other staff members. Nurses are able to devote more time to skills unique to or required of the registered nurse, focusing on more critical care approaches and not spending so much time doing tasks that somebody else could do. Care coordination, and so that's one of the things about managed care is we coordinate care with other disciplines, and we are the leaders in collaborating with these disciplines to get the patient what they need. So care coordination and case management are other examples. Care coordination is a collaborative effort in which an interprofessional team member provides cohesive care, cohesive meaning together, as a patient proceeds from hospitalization to recovery and health maintenance. We want them to get well as soon as possible and not come back to the hospital so frequently. The case manager coordinates and facilitates patient use of health services in the long term, so from admission to discharge to home, possibly in following up with home care. These processes eliminate redundancy and promote consistency, therefore lowering costs and improving quality. Successful delegation, care coordination, and case management depend on the ability of nursing leaders and managers who inspire their staff. You've got to have everybody on board, monitor patients through critical thinking, and adhere to organizational requirements. So following those critical pathways, following the guidelines. As a result, nurses' interpersonal skills are at the heart of good managed care, because you got to know how to communicate and collaborate when you are working in a managed care system, especially if you're a case manager. And I had the opportunity to be a case manager for 2.5 years in one point in my career, and I loved that job very much. Understanding the basics behind managed care is important for nurses as they move through their careers, no matter the level of leadership or managerial responsibility. You still have to understand how important managed care is. Each healthcare organization uses a specific model and understanding of managed care, and each organization layers its own goals, ethical standards, legal requirements into the model that they choose. Nurses move from one organization or setting to another. You've got to have knowledge of these models in order to be successfully caring for your patients. With this requirement in mind, this module and its exemplars introduce the many facets of managed care. And as you see on the next page, it talks about HMOs and PMOs. So let's look at that. So for PMOs and HMOs, you're looking at these are certain delivery models. Managed care is a system of healthcare used to coordinate distribution of resources to a subscribed patient population. It doesn't matter, all these critical pathways are for all age group of patients. And distribution of resources to a subscribed patient population in order to minimize cost and increase efficiency and patient satisfaction. Because one of the things that you have after you've been in the hospital is a survey. They'll send you a survey or give you a phone call, and these survey results fall under what's called HCAP scores. And these HCAP scores is what the hospital or how they get reimbursed. So in other words, I get a survey, I'm a patient in the hospital and I get this survey. And if I give the hospital a negative responses, then that could affect how much reimbursement that they get. And that system's been in place for a little while, and you can actually go online and look at the different scores for different hospitals and see how they overall score according to patient satisfaction. And sometimes there's 20 or 30 questions on these HCAP surveys. Two models of managed care are health maintenance organizations, or HMOs, and preferred provider, or PMOs. HMOs incorporate the use of a gatekeeper to track provided services and act as a referral agent for the patient population. PPOs allow patients to select from a larger network of physicians without having to use direct referrals to specialists. So with HMOs, you get a preferred provider, and then it's through a gatekeeping service, and then the PPOs is a network of certain physicians that are in with that specific payer source or insurance company. Nurses incorporate the nursing process in providing evidence-based care as we work within the managed care system. The nurses' work has important implications for direct patient care, coordination of care, and constant cost containment. For example, the nurse knows that the patient has an order for physical therapy and swallowing evaluations, but also knows that the patient tires easily. By scheduling the swallowing test and the physical therapy at different times, the nurse can make sure that neither professional wastes time waiting on the other and the patient has time to rest in between. And with these particular services, patient has to show progression to continue to get those services, and if they don't show progression, they will be discharged from those services, or it could deny payment if the patient doesn't show progression. Effective managed care requires the ability to prioritize, identify clinical pathways, and create concept maps and care plans. And so your text here refers you to Module 36, which is clinical decision making. The nurse must also understand patients' rights, which is Module 44, ethics, and advanced directives, which is Module 49, legal issues. We must be committed to quality improvement, and that is Module 50. You constantly want to focus on improving quality of care. So one of the ways that we do that is through case management. So what does a case manager do? A case manager is the coordination of patient care over time using the combination of health and social services necessary to meet the individual needs. So from the time the person's admitted till they're discharged, and sometimes even when they go home, the case manager follows them from day one. You know, what do you need? Do you live alone? Can you go back home living alone? Do you need a ramp because you have a wheelchair? Do you need home health services? Do you need to go to a rehab center or nursing long-term care facility? Case management is a fundamental element of many managed care systems. Case management offers intensive services, so it is most effectively and efficiently used for patients who have multiple and complex health problems. Say you had a stroke, or maybe you need to go to a rehab center. For example, a patient with COPD who has just had hip replacement would benefit from case management beginning at admission and continuing at the rehabilitation center for skilled nursing care. Generally, case management involves interprofessional teams that collectively assume responsibility for planning and assessing the needs of a group of patients. And notice up at the top, it's a combination of health and social services. So your social worker helps with providing this, the assessment pieces and seeing what the patient needs. And in respect to payment sources, like the social worker will help the patient get Medicaid if they need Medicaid to help pay for it. Or placement, they fill out a form called a FL2, and the social worker is involved in getting the proper paperwork for long-term care and rehab facilities. Generally, the case management involves interprofessional teams that assume collective responsibility, so the responsibility is shared. These teams are also responsible for coordinating, implementing, and evaluating patient care from pre-admission through discharge or transfer and recuperation. Each team is led by a case manager who is a nurse, social worker, or other appropriate professional. It could be contacting the home health agency or working with the pharmacy. In some areas of the United States, case managers are also referred to as discharge planners. You may hear that. These individuals may work for a patient's health care provider, such as the clinic or long-term care facility, the insurance company, or perhaps even the patient's employer. So the case managers are like the team leader of the collaborative team. Patient-focused care. This organizes the framework of healthcare services with the patient at the center. Patient focus or patient-centered care ensures that patients and their families or caregivers are integral to planning and making decisions. So in other words, they are involved. You don't just make all these plans and go tell the patient, hey, you're going to a rehab center. The patient's got to agree and want to do that. In patient-focused care, the nurse takes time to learn about the patient's lifestyle, habits, and the family. This includes being sensitive to diverse religious or cultural preferences. These preferences can impact diet, activity, and health practices, thus affecting patient adherence to the care regime. After gathering the necessary information about the patient's way of life, like I was saying, do you live alone? Are you able to walk? Do you need someone to stay with you? What's their home situation? So after gathering this information, the nurse works with the patient to develop a plan of care that addresses both health and personal needs. As part of this plan, the nurse helps the patient acquire the knowledge and skills necessary to manage the health condition and make informed choices. The patient-focused model recognizes it is critical for patients to retain autonomy and dignity while healthcare decisions are being made to improve health outcomes. And look at the top of page 26-23. You got a safety alert, and I really like the safety alerts because they really bring out specific points that are important. It says, with patient-focused care, the nurse should seek to honor the patient's preferences to the greatest degree possible. Make sure the patient is involved. Still, the nurse has the duty to do no harm. At no point should the nurse agree to a request that will potentially jeopardize the patient's well-being. Instead, the nurse should carefully and non-judgmentally inform the patient of the risk associated with the requested practice or intervention. So in other words, if the patient says, I'm going home by myself, and you know that that patient's not able to go home by themselves, we really need to, educate them on the risk factors. And maybe this is a mentally ill patient that's tried to commit suicide and they told you that they had a lot of guns at home. We really want to look at that situation and talk about, the risk involved. So differentiated practice is a system that uses academic credentialing, clinical training, and expertise to differentiate how roles are assigned. This practice model organizes the various roles, job descriptions, such as a licensed vocational nurse or LPN, registered nurse, or nurse practitioner, in nursing practice to facilitate improved patient outcomes. Determination of best practice includes the identification of skill sets attributable to each level of nursing. The ability to delegate care is specified based on establishing nursing competencies at the organizational level. And we do go by the Board of Nursing delegation rules as well. And each facility follows those rules when it comes to delegation. So you can't just delegate if it doesn't fall within the rule by the Board of Nursing. The ability to delegate care is specified based on established nursing competencies. By differentiating practice in this manner, healthcare organizations ensure that nurses are delivering high-quality, top-of-license care and not spending time on tasks. For example, changing bed linens, and you can help do that. Don't just say, oh, that's the nursing assistant's job. If you're right there and the patient needs help, help the nursing assistant. But you shouldn't be trying to give everybody their bed bath and do your med pass and do all your assessments and things like that. That's what it's saying. You got to delegate these tasks to the proper folks. So when we're looking at skills such as changing beds or, assisting the patient to the toilet, you may want to assign these to the unlicensed staff that they're trained to do those skills. Differentiation helps maximize the quality and affordability of care because the registered nurse really needs to be coordinating the care. Shared governance, and this is where we can serve on committees and make a difference in how policy and procedures are carried out at the hospital, but it's all based on evidence-based practice. And you can serve on these committees. You actually serve as a team member developing the governing rules for the organization. The shared governance model focuses on the key element of sharing as being the driving framework between bedside nurses and nursing leaders to affect clinical decision making and allocation of resources to improve patient outcomes. By using a shared approach, nurses become more interested in the organization because you're a part of that organization and your voice is being heard. Shared decision making results in increased nursing satisfaction, which in turn leads to positive patient outcomes. When you have a satisfied staff, they are going to provide excellent care for the patients, and that benefits the patients in a positive way. Case management or case method. The case method focuses on the assignment of a single nurse to provide all aspects of patient care and care coordination during the designated shift. This is a different role than case management. Case manager is a case manager and they manage the patient's care, what are their needs. But the case method is how do we assign who's the charge nurse today, how many nurses do we need on the unit based on patient load or patient admissions. So that's what case method is. This model assumes that the nurse utilizes nursing process, assessment, nursing diagnoses, implementation, planning, and evaluation in the coordination of care for assigned patients. Primary care nursing was derived from the case method and further defines elements of patient complexity to establish nursing assignments with the goal of minimizing the number of patients assigned to a nurse to promote best practice. Case method also keeps us from getting assigned too many patients. If you're on a busy med-surg floor, 10 patients is too much. And case method helps us make assignments during the day that equalizes the acuity level. For example, if I have 6 patients, 5 of those patients shouldn't be on isolation. Somebody else, I need to share that because isolation takes up a lot of time. The case method is often used in high acuity settings such as the ED and intensive care. Another safety alert. Information gaps often develop when patients are transferred from one facility to another, such as when a patient moves from the hospital to a rehab facility. They may also occur during nursing shift changes. Communication breakdown during the transfer or shift change process can result in life-threatening situations for the patient. For example, a patient's just had surgery and they're coming from the post-op to your unit and the nurse failed to tell you that they just had 5 milligrams of morphine and that did not document it. And so the patient's in pain and you give them 5 more milligrams, you just overdosed your patient. So there's a breakdown in communication. And that's some of the things that they're talking about there. To help prevent such situations, be sure to carefully and completely document all care provided to the patient, as well as to verbally communicate with the patient's new nursing staff. Communicate and document. If it's not documented, it's not done. Even if you did it, it's got to be documented. Functional method. And I really like this part because it talks about functional nursing and team nursing. And this is where we use these models to arrange how care is going to be distributed amongst the nursing staff and who's going to do which role. And so one of my favorite, and your book talks about team nursing and primary nursing, is team nursing, and that's really good on a busy floor, and primary nursing is really good in like your intensive care units. The functional method focuses on task as the primary factor in delivery of care by nurses to patients. Efficiency is the core element, with staff members who have less professional education than the nurse providing care with less complex requirements. Although this approach is economical and efficient, it can easily result in fragmented care. You have multiple staff members providing patient care on a single shift and may not capture the tasks that are more difficult to qualify and assign, such as responding to a patient anxiety or promoting culturally competent care. So with the functional method, it focuses on which person's going to do which task. And it requires a lot of people to do this method because you may be having an LPN doing the dressing changes, the RN doing the admissions, and nursing assistants doing X, Y, and Z. So the functional method can be a little costly because it requires a lot of staff sometimes. Team nursing, which is my favorite, it focuses on the delivery of care to a group of patients by a professional nursing team that is typically led by a registered nurse. Depending on the type of available nurse staffing at the institution, a nursing team may include a registered nurse who are specifically licensed and trained to deliver direct patient care, including patient assessment, identification of health problems, and development and coordination of care. The LPN or LVN, who provide direct patient care under the RN, physician, or the licensed practitioner. And the unlicensed assisted personnel, UAP, also called assisted personnel or healthcare staff, or patient care tech, some of the hospitals use that term, who assume delegated aspects of basic patient care, such as ADL needs like bathing and feeding and collecting specimens and vital signs, and they don't analyze, they just do the task. So when they take the vital signs, it is our role to analyze the vital signs and make sure that they are normal or abnormal. In team nursing, the assigned team leader, which is the RN, is responsible for the overall care of the group of patients, so like a charge nurse, and uses delegation principles as needed to coordinate care between the members. Depending on the acuity, and there's that word again, acuity, of the patient group and staffing, team nursing can be very efficient. And team nursing does work. And sometimes in team nursing, you may just have only RNs. You may not have any LPNs. Now, primary nursing, this is the RN oversees the comprehensive care for the assigned patient. Focuses on best practice, patient acuity, coordinate and implement consistency of care across the length of stay for the patient. So the RN is assigned to that patient, and they're responsible for all the care that that patient gets within the required shift, such as like a 12-hour shift. The primary nurse coordinates the patient's care and is responsible for coordinating information and facilitating with other members of the team during that time that they are assigned to that patient. And look on your slide here, it gives you a list of things. Primary nurse assesses, prioritizes, identifies nursing diagnoses, develops the plan of care, and evaluate. We always have to go back and evaluate. And I like the last line. Primary nurse is the first line manager of patient care. They are accountable for all of the care that's provided during that time frame. Concepts related to managing care. Again, this is on page 2625. So advocacy. We advocate to protect the rights of patients and vulnerable populations. Make sure you read over this. Nurses work in a variety of healthcare settings, and they work with different populations of people. We advocate for everybody. We don't pick and choose. Clinical decision making about patient care begins with analyzing assessment. Don't just do your assessment and not analyze your assessment findings. You're just focusing on skills if you're just doing the assessment. You got to analyze your findings. Even down to the minutest detail, you need to analyze that data. Prioritized care is a process nurses use to manage time and to establish an order for completing responsibilities. When I was working on my doctorate degree, that's one thing I created was a tool called the BOSS method, and I'll be glad to share it with you. And it shows you what nurses should be doing every hour of the day to keep you organized and keep you in a mindset of prioritizing care. Because our job descriptions does not say what you should be doing every hour of the day. So this tool has been very helpful in helping nurses stay on track, because what you do after lunch is not the same thing you did at 7 o'clock that morning. And another thing about clinical decision making and prioritizing care is, who are you going to see first? You need to see your sickest patient first, and then your least sickest patient last. So if you have 5 patients, after you get your change of shift report, you need to decide who needs my attention the most. In other words, who's going to die on me first? That's who you need to go see first. So in other words, I've got a patient running a fever, short of breath, They had put some oxygen on, a rapid response was called during the night, versus a patient that is medically stable and going to be discharged that day. Who would you go see first? So think about that. Communication. We can't do what we do if we don't communicate. We have to have therapeutic communication to learn about their condition and learn about what went on with that patient and what's in their chart. And we need to be reading their chart. I know you're thinking, gosh, Dr. Luck, we don't have time. Every minute that you have, you should be, finding out everything about that patient. And I'm just going to tell you, you can't nurse from the desk. You need to be down on the hallway in your patients' rooms and where your patients are. You shouldn't be at the desk all the time. It really bothers me when I see nurses sitting at the desk all the time, because who's looking after the patients? Not the nursing assistant's responsibility, it's ours. Ethics. We base everything on altruism, autonomy, human dignity, integrity, social justice. And I don't know if you've all had this. It should have been mentioned to you in fundamentals. It may not be mentioned in UR 212. Every school does it differently. But there is social policy statements put out by the ANA, and it tells us in these social policy statements how we're supposed to practice and how society expects us to practice. And they expect us to practice ethically and safe. And that's what the social policy statements say, that we should be safe. And if you hadn't seen them yet, I'll show them to you during this class. Healthcare systems, we work with federal, state, and local guidelines. We are in a very legal binding profession. Look, federal, state, and local guidelines. You can lose your license very quickly. You need to know that you know that you know what you're doing. You need to know the guidelines from the Board of Nursing. You need to know your scope of practice. You need to know what's in your Nurse Practice Act, because trust me, the lawyers know. Teaching and learning. We educate. Even if you're just at the bedside and administering a pill to somebody and you're telling them about their medication, that's educating the patient. So you need to give yourself credit for everything that you discuss with that patient. And so look, before I close, I want to talk a little bit about the concepts. Managed care is designed to provide cost-effective, high-quality care for groups of patients from the time of their initial contact with the healthcare system through their conclusion, from beginning to end. Managed care relies on collaboration among the patient, the family, the healthcare provider, and the case managers and everybody involved in their care. Care coordination and case management are significant components of managed care. Communication is a key concept, and it encompasses communication with the healthcare team and between the care team and the patient. Clear communication. It bothers me when I do change a shift report and the nurse says, oh, everybody's fine. I told one morning, because I had students, and I told that nurse, I said, if everybody was fine, they wouldn't be in the hospital. I said, they're here because they're sick. I said, we need more information. What happened on your shift? And if you don't get a good report, you need to ask for the nurse to give you a report. Because I've had some bad experiences with change of shift report, and I've just had to step up and say, well, what about this and what about this? And the night nurse that's ready to go home and tired, they're angry with me. But if you don't get a clear report, then you did not use your critical thinking and communication skills as well. Don't just say, oh, they gave me a bad report. Well, did you ask questions? Make them give you a report. Because we got to have clear communication with the nurses, doctors, and everybody involved in that patient's care. We want to improve the patient's perception and experience of care and eliminating costly duplications. Communication among team members and patients creates a relationship that is based on trust, and it helps patients be informed. And when they're more informed, they're going to be less anxious and they're going to be easier to work with. A lot of reasons patients are so angry sometimes is because they're scared. They've just been told they had cancer. What am I going to do? How am I going to pay for this? And we need to listen to them and let them talk and let them be a part of it. Don't leave them out. To provide high quality, effective care, the nurse must have a clear understanding of the best ways to manage personal time and patient time, as well as the best ways to work with the schedules of other professionals on the care team. Flexibility, we have to be flexible. And patience, oh my goodness, we have to have patience, are key to effective time management. That is a clear understanding of a patient's care priorities. You want to know how to manage your time? Do your job. Get your report and go to work. Don't go to the break room. Don't go down and get something to eat. Get your report. Go do your assessments. Look at your labs. Analyze your vital signs. Analyze your assessment data. And then get ready to start your 9 o'clock med passes. Document every 2 hours. The reasons nurses get behind is because they're standing around talking a lot or doing other things when they should be down in the patient's room. Now, don't get me wrong. I know there are other things. We have patients that code and people that are sick and, other issues. I do understand that. But a lot of time is wasted because we're socializing at work, and we need to be paying attention to what's going on with our patient. These skills are learned through practice and lead to more efficient clinical decision making. When making clinical decisions, nurses must be aware of the types of care that will be most beneficial for patients and advocate for that care when necessary. Speak up. Nurses maintain high ethical standards. We are the most trusted profession in the United States, and we need to continue to earn that title. We need to be ethical in our work. So we need to have high ethical standards as we work with other members of the healthcare team to ensure that the care provided is cost effective yet meets the patient's needs and does no harm. When you walk in that patient's room as a nurse, that patient's looking at you like, oh, my nurse is here. They expect you to take care of them because they know you're a professional. The nurse must also assume the role of teacher in managed care in order to educate the patient and family about the patient's acute and ongoing healthcare needs after discharge. Yes, we have to keep the patient and family informed, but remember our scope of practice, we can only share certain information. Now, you can tell them what kind of home health services that they're going to get when they get home, but you can't tell them the results of their x-rays or their CT scan or MRI. We know the physician has to do that. This teaching role is especially important because it helps the patient maintain health and reduce or avoid the cost associated with an acute exacerbation or recurrence of the disease or injury. So as you see, managing a patient's care is critical to cost effectiveness and providing holistic care and providing high quality, safe care. And that's where we want to be. We want to make sure that we are providing high quality, safe care.